Bismillahirrahmanirrahim. Welcome to video number 2 about fixing our healthcare. Our healthcare starts with accepting that corporations are not here to help us. They will not tell us the truth. They will just give us medication. When I went to Kaiser, they said, I am diabetic. As if I don't know that. And they said, we're going to offer you metformin and all of this. And I said, yeah, go right ahead. And I got out of there. And I didn't go pick up any medication because at the end of the day, if you are depending on your doctor to get healthy, you really are stupid. Their job is to hand you this. You have a problem? You know what? There's a medication for that. They have a deal with the pharmaceutical companies. Every solution can be fixed with a pill. It is not going to be fixed with healthy food, some sardines. How's your diet? What are you eating? Do you eat carbs? Do you eat bread? Do you know what insulin is? Nobody's going to tell you that. So yeah, there's a medication, you can manage it, don't worry about it. Keep coming here, we'll give you doses, we'll charge you more fees. So our hospitals today, what they do is simple. They do not give you an education. You ask any American, tell them, what is insulin? What is that? It's sugar stuff, who cares? You just take pills. You manage it. You type 2, type 1. There's different type of pills. No. I remember driving my truck, because I'm a truck driver, and I'm just driving, and then I become thirsty. I'm hit with a thirst I have never had. So I just stop my truck, drink water, and then I pee right away. Whatever I drink, I'm peeing. I can't hold anything down. My thirst keeps getting worse and worse and worse and worse. I said, what is going on? I don't have any healthcare. I don't have any doctor. Who educated me on health? So I just go, I'm thirsty all the time. I'm peeing all the time. What's going on? And they said, you have diabetes. I'm like, what? What do you mean? I've never had diabetes before. You meet the symptoms. So I meet this person called Dr. Berg, and he explains it. And he says, you see, insulin is just a key. It's a key that unlocks your cells to eat and drink so that your body, mitochondria, you can actually be a human being. But because you have abused eating food with bad oil and you have continuously spiked your sugar levels, your insulin keys are broken. Meaning, no matter what you eat, no matter what you drink, you are done for. You are starving to death no matter what. You don't have an option to start fasting, get off all the carbs, all the breads, all the cereals, any pasta, anything that spikes your blood, cut it out right away. So I fasted, started eating sardines, gave my body an opportunity to recover. No sugars, no nothing. And before you know it, everything came back to normal. I did not need to see a doctor. I did not need a pill. I needed knowledge how my body works. What is insulin? What do I need to eat? How do I need to eat? And so forth. It's a very simple understanding. Today, we have a healthcare market that has none of that. It's just a place where the government puts money. You can't touch it. You want to go buy veggies. Shame on you. This money belongs to insurance companies. You buy insurance from them, but you don't get to keep it. You go there, pay a premium, and that premium goes to subsidies. You're going to have healthcare. But in 3 months, if you skip your pay for 3 months, guess what? They just cancel it. That's the law. It's not that they don't want to cancel. Kaiser is a very good company. I want to make my payment, but the government doesn't want to help. They created something and they put a law. They put another law with Trump canceled, which was mandatory. This thing was mandatory. So this system was not created for the people, by the people, to the people. I will say it's a marketplace, but it's a marketplace that is missing the feedback from the individual. So I spoke about this idea of changing the marketplace to just cover everything. Covers my dental, covers my blood work, covers my full physical checkup. All of that can be reduced to almost zero because we can use subcontracting and we can destroy the hospitals. We don't need them. Remember, businesses have to be destroyed. It's not our problem. We can be, once we are educated, we're going to be healthy. We're not going to be taking their pills. We are really going to be educating ourselves. And to start that education, I remember going almost blind. And I just, when you get into your 40s, your eyes fail. And this is something called Vision Gold that I take, you know. And it has this berry complex and all kind of things that you didn't know. So there's a lot of things that the hospitals will never tell you. There is a natural remedy that you can eat, whether it is zinc. I mean, there's so much knowledge you just want to share, you know. You want to share whether vitamin C. I mean, probably vitamin D is what I really learned from Dr. Berg. Stops back pain, increase it. It's just, we just need to share knowledge, what we are eating, what we are drinking, so that we can be. So there's a lot of people who do this healthcare thing. They don't know what they're doing. They just sell you this. It's a marketplace for insurance companies. It's designed for them, not for the individual. So what I want to do is just introduce AI into the system. Introduce a spending card that belongs to you. That money came from the government. It goes to a spending card. You educate yourself. You eat good. You spend it on yourself. What about the hospitals? I don't care about them. What about the insurance healthcare card? We'll have to sit down with them, and we'll sit with tech companies like Google, Apple, all of these people. They already have technology. There's nothing the hospitals have, tech companies don't have. Laboratories, your stuff will be run. They can generate a report for you. A diet, AI can produce a diet for you. Yes. What we need is the spending to go back to the person. And then healthcare is available throughout the year. You go to this house. I went to Kaiser. I didn't like them. Immediately, I'm going to get another appointment, another local doctor, and I'm going to see how much patients they have, because AI is not going to lie. So basically, we have to redesign the healthcare system, but we have to keep the marketplace open. Those money must come from the government first, and that money has to remain the same. We want to build on what we have. We don't want to just destroy everything. The healthcare marketplace is already perfect. It just needs adjustments, education, tech companies, but the subsidies need to be increased so that the person just remains healthy. This is the problem they don't want to tell you. Once you learn how to eat naturally and you take your multivitamins and you exercise, you know, you're going to be healthy. Especially if you don't drink, if you don't smoke, you're going to be healthy. And that's a problem for hospitals. It's a problem. That's why we have to create smart contracts for healthy people. And then doctors and nurses get paid. If you don't come to the hospital and you're not getting sick and you're eating healthy and you're educated, that's what we want. We want a nation that is healthy. A nation that doesn't need to go to the hospital. A nation that does its lab work, does its doctor visit, goes to the chiropractor if possible, learns how to stretch, and taking sleeping very seriously. If you sleep, you get this fluid that washes your head, you know, that gives you a health reset, sleeping from 10 to 4, you know. Simple things like that. So for me, it's really simple. We have an opportunity to build on healthcare, build on the market healthcare, remove all these people, increase the funding to people like me and other people who will cook good food. When you come to get healthcare, you're going to meet with someone like me, a healthcare coach from the Trump administration. Okay, do you know what insulin is? What's your diet? Okay, I'm going to increase your spending to $2,000. You're eating all kind of crap and cereal, but this card is going to monitor. You will go through it. You'll take a picture, you know, and you'll be in a system. And you'll have an AI companion. That's what we need. We just need to trust the people who know what they're doing. Give us a chance. And the healthcare system problems will just evaporate. So if you're an American, listen carefully. Things need to happen. We need a spending card. Money goes directly to us. The money for healthcare also remains the same in the marketplace, but it's increased and it covers your healthcare according to your income. This idea after 3 months, they just cancel your healthcare like they're doing it to me. They've been doing it for many, and I don't care. It just cancel. Who cares? I got my checkup. I did my dental. I just cancel it. I'm not going to continue making payments when I don't have the money. It's crap. So that's where the government is going to just increase the funding, cover my cost. The job of the American citizen is to be healthy, to be educated what is healthy, know what insulin is, cover their gym, cover their medication that we are going to be probably sending from Amway. It's all the vitamins and everything. We need a healthcare coach. We don't need to worry about hospital bottom line. Some of them need to be destroyed. If they're not a specialist, they're not doing heart surgery, they're not doing breaking bones, whatever, they need to stick to that. But they're not going to be seeing healthy people like me in the hospital forever. I don't want to go there, and so do many Americans. We would like to be educated. We would like to get our spending card so we can have a back body. People want to get a massage. Let them go get their massage. Let them go buy their healthy stuff. Let them go get more money. Stop playing games with us as if the government is doing us a favor. You are not doing us a favor. You are screwing us. You're cutting us. You're giving us some subsidies. You don't know about our jobs. You're not helping us. You're not listening to us. You're not making us healthier. You're making us sicker. But the Trump administration has done a great job in and out. The tomato is now no corn syrup. Some of the juices, they're using cane sugar. So the Trump administration has already done some things. And I think I wanted to just go through that quickly so you can understand. This is absolutely incredible. Anybody who loves getting things done, you don't want people to lie to you and tell you that, oh, nothing is going on. I sent a video to the president, and let me tell you, I want to just go through what the president has already accomplished. Price transparency with consumer choice. Issued federal rules requiring hospital insurer to publish negotiated price, giving consumers visibility into real cost. Second thing he's done, prescription drug cost reform. He signed executive orders to curb pharmacy benefits for managers, middle managers, important. Some of the CVS, some of the other companies, they shut down all because their money was coming from PBMs. If you go around America, there was Rite Aid or something, they shut down all of that because they were making money on that, and the president shut them down. He adjusted, streamlined, and drug regulatory, reducing thousands of pages of healthcare. Reduced thousands of healthcare regulation to simplify billing and compliance. And then we have his Secretary Kennedy. What an incredible person that guy is. He helps digitize reform to allow AI-based claim auditing, cutting administration cost over 10%. And then nutrition wellness, supported program highlighting food quality, sugar reduction, and obesity prevention. Even Coca-Cola is talking about using real sugar. The president is making real gains, and this is his legacy, let me tell you. Make America Healthier. MAHA emphasizes prevention, clean food policy, cutting waste, the department. He proposed shrinking bureaucracy, redirecting towards chronic diseases and local illness. So there's a lot of things that are going on, and we're going to have a discussion. I'm going to challenge most of you to bring your bills, your Casa Permanente bills. I can't show my bills, but I'm sure you understand, I have to double make sure it's not nothing personal, but it's from Kaiser. They send you all this other junk stuff that I just wanna end the video with this specific number that they send me. This is the amount that rocked America. It's not a lot of money, It's not a lot of money, but it is what I experienced, and it's right there. That amount. How is healthcare screwing you over? What has been your experience when you're dealing with healthcare companies and they just overcharge you, send you a bill, cancel your healthcare because they don't care about your financial circumstances? I drive a truck, I drive Uber. and even they suck. You can't even buy insurance. It's not that we're not allowed to have a savings. We're not allowed to start businesses. And there's nobody listening. I sent a lot of tweets to the President Obama. He never listened. He's very educated. Big deal. Harvard, anyone who's educated, they're not in their right mind. Oh, why should I listen? Why should I reply? I'm so famous. Horrible. Trump is reading everything on the internet. He's listening to everyone. So bring you a healthcare bill. The president is going to listen to us. The president is going to work with us, and we're going to fix the healthcare system. It's not complicated. You eat healthy, you learn healthy, you keep your money, you're spending, you can pay for your gym, you can pay for your massages, you can pay for all your. I have all of this stuff. Let me tell you, I got a lot of stuff. I got a lot of stuff in here. I don't even want to share. All kind of stuff that I'm eating. And I just wanted to end it, just show all my stuff that I'm kind of taking just to be healthy, just to be healthy. Sea moss, which is very nice. Sea moss is the healthiest. It has everything you need as a human being. If you don't eat sea moss, you don't know what you're talking about. If you're diabetic, you can take like multivitamins like this. I also made a commercial about that sunscreen for those who know. And I think I will end it with something natural. We want to share information together. We want to live a healthy life together. This is beef tallow that you can use for your face. I mix it with my cream for those who know. We're going to make something special happen. Anyway, I want to conclude it here because we have a problem. The problem is that we don't have a home on the internet where you can blog and share and be a community. And healthcare is not part of whether it's mental health. I want healthcare to just be a smart contract. Your mental health, your food, your exercise, your education, and protect us from cooperation. And Trump is going to fight like a man, Mr. President. Let the people listen. Let the corporation come in with a sourdine. King Oscar. You never know. They always leave a commercial or something. Sometimes they leave some gifts and sometimes they don't. But it has to do with the brand currency system. And I'm always surprised what gift they have in there. Anyway, I'm going to end it here. And we will change healthcare. There's going to be an AI. For me, I'm building an Islamic AI where I'm going to put holistic food. You're going to meet with a coach who's probably going to be your healthcare director, making sure you're taking your vitamins, you understand what insulin is, you are eating healthy. The American people need an education. They need an education that pushes them forward. And they don't need a system that is a scam, okay? This thing is a scam because it cuts you off when you need it. It doesn't let you save. It goes to corporation. It doesn't go to me. I need dental. I would have used that and said, you know what? I'm done. You as a Kaiser provided me service. I'm stopping my healthcare. I'm switching it to dental. That's what that money is coming from the government. It's coming to me. It's coming to my account. I don't want your healthcare anymore. I want to do dental. Okay. And then dental is increased. I get my dental. Okay. I can go back to my account. It's like a marketplace. Who's going to give me? Okay, I have problem with my eyes. I'm going to go to my natural and therapist, a person who's telling me, you know what? You're in your 40s. Your eyes is going to be failing you. You need to start taking this vitamins. We need to start taking natural remedies seriously. And we need to transform this thing and turn it into something AI. Welcome health AI companies. Welcome natural. Some people like Dr. Berg and other people. And let's just create something that makes America healthy, empties the hospitals, empties them completely. You don't need to go to the hospital. You're healthy. You're mentally healthy. You're physically healthy. You know what you're eating. You know what insulin is. It's a done deal. Let's make America healthy again. Maha, baby. Okay? Thank you for listening. And we'll end it there. Have a good day. Bismillahirrahmanirrahim. Alhamdulillah. May God bless us and give us the blessings of living a long, healthy life, inshallah, God willing. Thank you for listening, and goodbye, everybody.